One compound attracting attention is pterostilbene. It is chemically related to resveratrol, but demonstrates substantially greater bioavailability. Research indicates that pterostilbene may cross the blood-retinal barrier and act directly on DNA damage occurring within light-sensitive retinal cells. This distinguishes it from many antioxidants that never reach the tissue where support is needed. A study published in Nutritional Neuroscience during 2023 found that older adults who consumed wild blueberries daily for 12 weeks demonstrated measurable improvements in visual acuity. Participants also reported noticeably less eye strain when using digital screens under low-light conditions. Not all blueberries provide identical benefits. The larger cultivated berries commonly available in supermarkets contain lower concentrations of antioxidants. Wild blueberries, the smaller and darker varieties frequently found in frozen food sections, contain nearly twice the level of active compounds. Frozen berries were reported to be just as effective as fresh ones. The recommended serving is approximately 1/3 of a cup of wild blueberries around 45 minutes before bedtime. There is another important detail. Avoid combining them with dairy products. Proteins present in milk can bind to anthocyanins and reduce their absorption within the digestive tract. Instead, lightly freeze and then thaw the berries before consumption. This process breaks down cellular structures and increases antioxidant bioavailability, allowing those compounds to become more accessible during overnight repair activity. The next fruit often surprises people. Dragon fruit is visually striking, especially the red-fleshed variety. Research suggests it may be among the more effective fruits for supporting oxygen delivery to the eyes during sleep. Individuals who wake with tired, heavy-feeling eyes, despite a full night of rest, may find this information particularly relevant. The variety is critical. The desired option is dragon fruit with deep red flesh. White-fleshed varieties do not contain the compounds being highlighted. The issue associated with this fruit is retinal hypoxia, a condition in which retinal tissue receives insufficient oxygen during sleep. When this occurs, a person may sleep for a full 8 hours yet still awaken with fatigued eyes. Peripheral vision may become less clear. Colors may appear less vibrant. Over long periods, continued oxygen deficiency may contribute to cumulative damage. Red dragon fruit contains betalains, a group of antioxidants shown in research to support nitric oxide production within blood vessels. Nitric oxide relaxes and widens capillaries, including the tiny vessels supplying the retina. Wider capillaries may allow greater delivery of oxygen and nutrients to retinal tissue during deep sleep. A study published in Frontiers in Aging Biology during 2022 reported that participants using red dragon fruit extract for 6 weeks experienced meaningful improvements in ocular circulation, contrast sensitivity, and visual field depth. In practical terms, participants reported clearer vision under low light conditions and noticeable reductions in blurry eyesight. The suggested use is 1/2 of a red-fleshed dragon fruit approximately 1 hour before bed. There is one additional point that is frequently missed. The black seeds should be chewed rather than swallowed whole. These seeds contain omega-3 fatty acids and magnesium, nutrients documented to play roles in retinal nerve function and repair. When swallowed without chewing, much of that potential benefit may be lost. The next fruit on the list is goji berries. Bright red in appearance and mildly sweet in flavor, they carry a history that stretches back thousands of years. Goji berries have been used in traditional Chinese medicine for more than 2,000 years, with a specific focus on supporting vision. Today, scientific findings are beginning to reflect similar observations. The primary concern linked to goji berries is macular thinning. The macula forms the central portion of the retina. It allows people to read, recognize faces, and perceive colors with precision. As the years pass, oxidative stress together with reduced blood flow gradually weakens this tissue. This process lies at the core of age-related macular degeneration, one of the leading causes of permanent vision impairment among older adults across the world. What distinguishes goji berries is their zeaxanthin concentration. Among natural food sources, they rank among the richest providers of this nutrient. While lutein mainly safeguards the outer retinal layers, zeaxanthin accumulates primarily within the macula, the area responsible for central vision. That concentrated protection is significant. Clinical evidence has attracted considerable interest. A study published in Nutrients during 2021 monitored adults between 60 and 80 years of age who consumed dried goji berries 5 days each week for 90 days. Researchers observed a substantial increase in macular pigment optical density, a direct indicator of macular protection. During the study period, none of the participants experienced additional progression of macular degeneration. For individuals concerned about preserving visual independence, this outcome stands out. The suggested method is straightforward. Place 2 tablespoons of dried goji berries into warm water and allow them to soak for approximately 10 minutes. Consume them around 30 minutes before bedtime. Soaking improves softness and supports digestion, a useful consideration for older adults. There is another recommendation supported by research. Combine the berries with a small piece of premium dark chocolate containing at least 85% cacao. Flavonoids present in cocoa have been shown to enhance zeaxanthin absorption. Together, these nutrients form a combination that may provide additional support to the macula. The final fruit on the list is papaya. It is neither rare nor expensive. In many homes, it may already be sitting in the kitchen. When consumed properly, papaya is associated with one of the most overlooked contributors to blurry vision, cloudy lenses, and early cataract development. The process involved is glycation. This occurs when excess glucose in the bloodstream attaches to proteins within eye tissues, producing advanced glycation end products. These compounds gradually cloud the lens and contribute to retinal deterioration. Glycation remains one of the less recognized drivers of age-related visual decline, and it continues quietly in many adults beyond the age of 60. Papaya contains papain, a naturally occurring enzyme known for anti-inflammatory and protein-modifying properties. The fruit also supplies vitamins A, C, and E together with folate. Research has consistently connected these nutrients with tear film stability, retinal support, and lower oxidative stress within the eye. A study published in Clinical Gerontology during 2023 reported that older adults who consumed papaya during evening hours displayed reduced glycation markers during follow-up assessments. Researchers also observed stronger tear production and measurable improvements in contrast vision after 6 weeks. For older individuals dealing with dry eyes, blurry vision upon waking, or early cataract development, these outcomes were considered meaningful. The recommended serving is 1 cup of ripe papaya cubes, approximately 1 hour before sleep. 2 details are important. Fresh fruit is preferred over processed forms. Room temperature papaya is also preferred over chilled fruit. The fruit should be removed from refrigeration 30 to 60 minutes before consumption. Lower temperatures reduce enzyme activity, and papain is intended to remain as active as possible when it reaches the digestive system. Papaya should not be eaten together with dairy products for the same absorption-related reasons previously discussed with blueberries. Another suggestion is to add freshly squeezed lime juice before eating. The vitamin C supplied by lime can improve the body's utilization of vitamin A. As a result, the eyes may gain greater access to these nutrients. The flavor also becomes more enjoyable. Before concluding, 5 important guidelines should be considered. Without them, even consuming every fruit discussed may not provide the full potential benefit. The first guideline concerns calcium-rich foods. Eating papaya or blueberries shortly after milk, yogurt, or calcium-fortified cereal may interfere with the body's ability to absorb lutein and zeaxanthin. Research has indicated that meals high in calcium consumed alongside antioxidant-rich fruit can reduce uptake of key eye-supporting nutrients by as much as 30%. Allow at least 90 minutes between dairy products and fruit intake. Evening fruit is best treated as a separate snack rather than part of a larger meal. The second guideline involves healthy fats. Many of the nutrients found in these fruits are fat-soluble. Without fat present, absorption remains incomplete. Several walnuts, 1 teaspoon of flaxseed oil, or a few slices of avocado consumed alongside fruit can increase nutrient absorption by more than 50% according to published studies. The food remains the same, but delivery to eye tissues becomes far more effective. The third guideline focuses on washing methods. Many people are surprised to learn that vigorous scrubbing under strong running water can remove a substantial portion of surface antioxidants. This is especially true for blueberries and black currants, where protective compounds are concentrated in and near the skin. Use cool water and rinse gently. Dry carefully and wash fruit immediately before eating, rather than hours beforehand. Many people believe that blurry eyesight is simply something that comes with age, a condition that must be accepted without question. You wake up with eyes that feel dry and irritated. You try to read a menu from across a restaurant, but the words seem unclear. Driving at night becomes more difficult as oncoming headlights create glare that leaves you uncomfortable and tense behind the wheel. However, the reality is more complicated than aging alone. According to the American Optometric Association, after the age of 60, the eyes become considerably more vulnerable. Problems such as dry eye syndrome, cataracts, macular degeneration, and even sudden blurred vision affecting only one eye occur much more frequently. The National Eye Institute has also reported that vision impairment among Americans is increasing at a faster rate than ever previously documented. One concern is that significant damage can develop during sleep. While the body is resting overnight, the retina, the light-sensitive tissue located at the back of the eye, may not always receive adequate oxygen and nutrition. The photoreceptor cells responsible for helping us see clearly can gradually deteriorate. This process is often silent, and many individuals do not recognize it until noticeable vision changes have already occurred. A common question is simple: why does vision become blurry, and is there a natural way to support eye health without relying entirely on costly medications or surgical procedures? Many conventional approaches, including eye drops, stronger prescriptions, and laser treatments, are designed primarily to address symptoms rather than underlying factors. Research published in JAMA Ophthalmology during 2023 reported that age-related retinal damage frequently begins with subtle changes deep within the eye. Oxidative stress and persistent low-grade inflammation play important roles. These processes are especially active during nighttime hours, when the eyes would ideally be carrying out repair and maintenance functions. More recent findings have highlighted another possibility. Certain commonly available fruits contain naturally occurring compounds that may help support the eye during sleep. These nutrients have been associated with retinal circulation, photoreceptor health, and a slower progression of macular degeneration, which remains the leading cause of central vision loss in adults older than 60. In other words, there may be ways to encourage healthier vision through dietary choices while sleeping, without adding another prescription medication or scheduling another procedure. One fruit in particular has attracted attention because it contains a natural enzyme that research has linked to interference with processes associated with cloudy lenses and the early development of cataracts. The following list begins with number 7. Kiwi may appear small and unremarkable, but research suggests it offers noteworthy benefits for aging eyes. As people grow older, the retina becomes increasingly susceptible to oxidative damage. Cellular wear accumulates over time. Eventually, road signs may become harder to read, nighttime headlights may appear as starbursts, and morning vision may remain unclear long after waking. Evidence indicates that these changes are connected to cellular stress. Kiwi contains 2 nutrients frequently highlighted by vision researchers, lutein and zeaxanthin. These compounds function like internal protective filters. They are stored within retinal tissue, where they absorb harmful blue light and provide antioxidant support during overnight repair activity. Kiwi also delivers a combination of antioxidants, along with a modest amount of serotonin. This may contribute to deeper and more restorative sleep. Quality sleep is important because many repair processes occur during those hours. A study published in the Journal of Nutrition and Healthy Aging reported that older adults who ate 2 golden kiwis each day experienced measurable improvements in visual sharpness. Researchers also observed reductions in morning eye dryness and redness. The recommendation is straightforward. Consume 2 golden kiwis approximately 1 hour before bedtime. Compared with green varieties, golden kiwis contain more lutein, produce less acidity, and are often easier to tolerate at night. Another detail involves preparation. The thin layer of flesh located directly beneath the skin contains concentrated caffeic acid, an antioxidant compound. Rather than removing all of that portion, scoop out the fruit while leaving the outer edge largely intact. A fruit as ordinary as kiwi has been associated with improved nighttime visual performance and less morning discomfort, without pills or procedures. The sixth fruit is watermelon. Anyone who experiences blurry vision after waking may find this especially interesting. As aging progresses, the eyes tend to lose moisture more rapidly. Blood circulation to the retina can also decline over time. Reduced circulation is considered one factor behind morning blurriness that may persist for hours. Watermelon consists of more than 90% water, making hydration an obvious advantage. Yet studies point toward another benefit as well. Watermelon is among the richest dietary sources of lycopene, a carotenoid antioxidant that has been associated in observational research with reduced oxidative stress affecting retinal cells. Potential protective effects have also been explored in relation to cataracts and macular degeneration. Research has further shown that individuals who consume watermelon regularly often display higher circulating levels of lutein and zeaxanthin, the same vision-related nutrients previously discussed with kiwi. Research has suggested that certain substances found in watermelon may encourage nitric oxide production and promote healthier peripheral circulation. Better blood flow could mean improved delivery of oxygen and nutrients to retinal tissue while sleeping, a period when the eyes rely heavily on restoration processes. The suggested approach is simple. Consume between 1 and 2 cups of chilled seedless watermelon around 30 minutes before bedtime. Avoid adding salt. Extra sodium may elevate intraocular pressure, a factor identified by the Glaucoma Research Foundation as an important and potentially permanent contributor to vision loss. There is another detail many people overlook. The pale white layer located just beneath the rind contains citrulline, an amino acid associated with healthy vascular function and possible support for nighttime nourishment of the eyes. It can be blended into a smoothie or prepared as a lightly pickled food. Next comes black currants. Many Americans have never purchased them, despite their reputation in vision research. These small berries, distinguished by their deep purple color, have drawn attention for their potential role in supporting eyesight, particularly under low-light conditions. The issue they are often associated with is retinal microinflammation and diminished circulation affecting the optic nerve. As years pass, chronic low-level inflammation may contribute to blurred vision, halos around headlights, and increasing eye fatigue in darker environments. These are not concerns that stronger eyeglass prescriptions can necessarily address. The effectiveness of black currants is largely attributed to their exceptionally high anthocyanin content. These pigments create the berry's rich color and appear to provide several actions within the eye. They help moderate inflammation. They support dilation of blood vessels. They also assist in restoring rhodopsin, the visual pigment that allows the eyes to transition from bright surroundings into darkness. Clinical evidence has been noteworthy. A randomized, placebo-controlled trial involving glaucoma patients reported that 50 milligrams of blackcurrant anthocyanins each day over 24 months significantly enhanced circulation within the optic nerve head and retinal regions. Researchers also observed a meaningful reduction in the progression of visual field loss compared with placebo. Another pilot investigation involving patients with normal tension glaucoma found that blackcurrant anthocyanins increased retinal blood flow without altering eye pressure. The study additionally reported normalization of endothelin levels, a compound involved in blood vessel constriction. These findings suggest potential neuroprotective effects, even among individuals without a diagnosed eye disorder. Evidence is also emerging that anthocyanins from black currants may improve dark adaptation, the process that allows vision to adjust when moving from bright areas into dimmer settings. For older adults who find nighttime driving difficult or experience challenges, when transitioning between different lighting conditions, this may be especially relevant. Fresh black currants are not always easy to locate in standard grocery stores. A standardized blackcurrant anthocyanin supplement providing approximately 50 milligrams daily is commonly suggested for evening use alongside other fruits. For improved absorption, combine it with a small serving of healthy fat, such as several walnuts, or with a source of vitamin C like an orange slice. nutrient interactions can play an important role. Another fruit that is already present in many households is the blueberry. Yet there is a detail that often surprises people. The way blueberries are commonly consumed may reduce a considerable portion of their eye-supportive properties. Blueberries are frequently discussed in relation to oxidative damage affecting photoreceptors. These specialized retinal cells are responsible for focusing, recognizing fine detail, and adapting to changing light conditions. Years of ultraviolet exposure accumulate. Natural antioxidant defenses slowly decline. Over time, people may notice themselves squinting more often, struggling in dim environments, or wondering why vision appears blurry even while wearing corrective lenses. The fourth guideline concerns temperature. Room temperature is preferred over cold storage. Refrigeration can reduce enzyme activity in several fruits, particularly papaya, because of its papain content. Below certain temperature levels, these enzymes lose effectiveness. Removing fruit from refrigeration 30 to 60 minutes before consumption allows it to return to room temperature and helps maximize potential benefits. The fifth guideline is timing. Consume fruit approximately 60 to 90 minutes before bedtime. If eaten too early, nutrients may be metabolized before the eyes enter their primary overnight repair phase. If consumed too late, digestion may interfere with the deep sleep needed for restorative processes. When timing is optimized, these compounds have the greatest opportunity to provide the support suggested by research. Taken together, blurry vision should not automatically be viewed as an unavoidable consequence of aging. In many cases, identifiable factors are involved. Oxidative stress, inflammation, reduced circulation, glycation. Evidence continues to suggest that certain fruits, consumed properly and at the right time, may help support the eye's natural repair processes during sleep. Imagine reading comfortably without squinting. Imagine feeling more confident while driving after dark. Imagine waking up and seeing clearly within minutes. Imagine looking at family members and appreciating every detail. The goal extends beyond vision alone. It is also about independence, confidence, and overall quality of life. If you found this information valuable, share it with someone who may benefit from learning about these research-supported nutritional approaches to eye health. Small daily habits can make a meaningful difference over time. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.